Hi everyone, it's Dr. Cervone here with Cumberland Chiropractic and Sports Medicine. This month we're talking all about knee pain. Now certainly there's different types of knee pain. You can have knee pain that's coming from, let's say, an old injury. Stuff that's actually wrong with the knee joint, with the tissues around the knee joint. But what if that knee pain is a victim? What if there's a bully some other place that's making your knee pain worse, or that's the direct cause of the knee pain? That's what this video is about. We're gonna give you 3 simple screens at home to figure out, is there another place that's making your knee pain worse? So stick around. Okay, so like I said, we're talking about knee pain that could possibly be coming from some other place. One of the most common places we see where there's a motion problem that can be contributing to knee pain is at the foot and ankle. So we can do one simple little test and screen to see, do we have enough mobility at the ankle? And if I don't, is that contributing to a knee problem above that? So what I'm gonna do is I'm gonna get down on my knee. If you need a pad to put down and kneel on that, that's fine. We don't wanna cause knee pain with this. We're trying to look for ankle problems. What I'm gonna do is we need about 5 inches of dorsiflexion, which is when I bring my toes up towards my head, I bend the ankle. We need about 5 inches of good dorsiflexion. That's about the width of your hand. So if I take my hand and I put it down on the floor in front of my feet, that's about 5 inches. I'm gonna take a broom or something straight and I'm gonna mark that on the floor with that broom. So now I got a marker here. What I'm gonna try to do is, can I push my knee towards that broom and hit it, or is it limited? So as I go forward, do I have enough dorsiflexion at the ankle to touch my knee to the broom without the heel coming off the ground? I don't want to lean forward and have the heel come up. That's not dorsiflexion. If I can do that, I have pretty good ankle mobility there. The second part of this is I don't want to cheat. I don't want to twist at the pelvis or the knee. So as I'm going forward, I mark it, I put my broom down, I'm going to start to come forward, and my knee should stay directly over my toes. What I don't want to see is this twist happen. A lot of people say, look, I can do it, but I am not doing dorsiflexion here. I am doing rotation at the ankle. That rotation will work its way up and put stress on the knee joint too. Okay, my second test is I'm looking at not just ankle dorsiflexion with this, I'm looking at, do I have control of the hip? So this kind of mimics when I'm walking, when I'm squatting, running, being active. Whatever the case, do I have control of this hip? Do I use the glutes to stabilize my pelvis as I start to bend the knee? If I don't, I can get some twisting at the knee as well. And this test is for the dorsiflexion at the ankle as well. So I'm going to balance on this left leg. Whatever side you have knee pain on, that's the side I want you to test. I'm gonna balance on my left leg. I am going to extend my right leg out a little bit. So I just need the balance here. The first thing we're gonna see is, and do this in front of a mirror so you can kind of visualize what's going on. When I balance on this leg, do I automatically get this side that I'm balancing on? Does the hip pop up? So if you can see my belt, when I balance, it should stay fairly level. If it pops up, I have a hip control over here. I'm not stabilizing this hip well. I'm gonna balance out, and I'm gonna very slowly bend down and try to touch my right heel to the ground. And I'm gonna come back up. It should be nice, smooth. You shouldn't lose your balance. Not a lot of excess hip motion side to side. And I wanna see that dorsiflexion, just like our other test. I wanna see the knee go right over the ankle. If I can't do this, if I don't have dorsiflexion at the ankle, I'm gonna drop down and we're gonna get that same kind of twist that we got before, or you might see the ankle get very wobbly. If I don't have hip control, as I go down, that hip's gonna pop up. The same sort of twist happens here. I don't have control here and I feel unstable. I've done 2 good tests for the lower extremity to see, is the hip causing some knee pain? Is the ankle causing some knee pain? So what's the last test we're gonna do? We're gonna see if this knee pain is possibly coming from the spine, or does it have a little bit of spinal involvement there? There was a big study that came out that showed almost over 40% of people with isolated lower extremity pain somewhere in the leg, it had some component of it that was coming from the spine. So we can do 2 simple little tests here to see, do I have a spinal component? So the first thing I'm gonna do is I'm gonna do this in bed, on the floor, wherever's the most comfortable for you. But we're going to do what we call repetitive end range loading and extension, that is bending the back. So I'm gonna lay on my belly, I'm gonna put my hands directly under my shoulders, I'm gonna take a big breath into my belly, and I'm gonna press up as far as I can go. When I get to the top, I'm gonna let that air out. And I'm gonna go back down. And I'm gonna do that repetitively, nice and slow and controlled, about 10 to 15 times. What I'm paying attention to when I'm doing this is my knee pain changing? If I do 10 to 15 and I stand up and walk around a little bit and say, you know what, my knee pain is less, I don't feel it as much, or it's changing slightly. That's a good sign. That means something is going on with the spine. That repetitive extension loading is changing that. It's making it better. Our red flag for this, if you're doing that exercise and it makes the knee pain worse, stop immediately, quit doing it, and probably give us a call because we got something going on in the spine that we need to fix there. The second version of this is if that doesn't change it at all, maybe it's not an extension problem, maybe it's a flexion problem. So I'm gonna lay on my back. I'm gonna start laying flat, and I'm gonna start with one leg at a time. I'm gonna grab my right leg, grab my knee, and I'm just gonna pull it up towards my chest. As far as I can go. And then I'm gonna let it go down. And I'm gonna do this repetitively about 15 times. I'm gonna grab the left leg, and I'm gonna do the same thing about 15 times. If you can, I'm gonna grab both knees, and I'm gonna do the same thing as far as I can, about 15 times. If you can't grab your knees, grab a belt, put it around your knees, and pull with that. That works just as good. And I'm gonna do the same thing we did with extension. I'm gonna see, does that change my knee pain as I'm doing this? If I'm bending the knee and it hurts to do that, as I'm bringing it up, it hurts my knee to do that. Quit doing that one, where you can do a seated version where I sit on the edge of a bench or the bed, wherever. I'm gonna space my knees apart, and I'm gonna think, just bend straight down towards the floor and come back up. We do that 10 to 15 times and we see if it changes the knee pain. That's a way to see if it's coming from the spine at all. Okay, so we got 3 good screens there to see, are any of these bullies outside of the knee beating up our victim? It's the knee pain. If any of this stuff looks like you, or you're noticing this, give us a call. This is stuff we fix every single day. Not only are we gonna address the knee pain that you got going on and get rid of it, we're gonna fix these bullies to keep it from coming back long term. If you like this video, give it a thumbs up. If you know somebody with some of these problems or you see it in them, share it with them. Leave a comment, ask us questions. We love when you guys ask us questions, but please let us help you with these issues. That's what we do best. This has been Dr. Cervone with Cumberland Chiropractic, where we get you better faster.